donations, the private vigil outside of our place of residence. These are all things that we say are available to Australians rather than coming together. There will be a time, there's always a time for protest, but it's not at this moment, not in a mass gathering form. The right to protest is fundamental. The means of coming together and risking the spread of COVID-19 is something we say to people, please think again, please do not do this, exercise your compassion, express yourself, but do it in a way which is safe, sound and respectful of our most vulnerable Australians. And with that, I'm very pleased to be able to invite the Chief Medical Officer, Professor Brendan Murphy.
Thanks very much, Minister. So as the Minister said, we obviously respect the right to protest and we obviously understand and appreciate the passion for this cause. But as we've gone through this pandemic, a key feature has been the fact that governments and the Australian people have at all times heeded the expert medical advice. And I'm proud to say that that expert medical advice has been very much responsible for the situation that we are now in, with very, very significant suppression of the virus, very small numbers of cases. But make no mistake, this virus is still in our community, probably in small numbers. But as we have been very cautiously relaxing our restrictions over the last few weeks, we have been very, very wary about not doing things too quickly, not increasing the risk of community transmission. The Australian Health Protection Principal Committee met just before today, this press conference earlier today, and we discussed this issue of mass gatherings, and we have put out a statement, as the Minister said, expressing our serious concerns. The reason the state and territory health departments have regulations on gathering sizes are very sound reasons. The more people you have together, the closer they are together, the higher the risk. A mass gathering, even if people try to make it safe by trying to practice distancing and hand hygiene, is inherently dangerous because people can't really keep apart. They can't stop touching each other. We don't know who is there. We can't contact trace. So we really ask you to respect the rules and regulations and policies that have been put in place across the nation to limit the size of gatherings, limit the nature of gatherings. Please, we have done so much, we have sacrificed so much as Australians to get us in an enviable position of where we are now. It would be very foolish to sacrifice by exposing the population to a larger outbreak, all of those gains, or many of those gains, by uncontrolled large gatherings. This is a time for all Australians to be incredibly cautious. We have to be cautious as we live through the next few weeks and months of this virus. So please, I continue to say we are not out of the problems with this virus yet. It is with us, and please do as the Minister and I have said and avoid mass gatherings. Thank you.
I'll just invite Bill Trevesky from the Heart Foundation.
Thank you. I'd just like to acknowledge the Minister, the Honourable Greg Hunt, and also Chief Medical Officer Professor Brendan Murphy. The Heart Foundation, and on behalf of the Australian community, greatly welcome the funding today, the announcement for $29 million invested in cardiovascular research. It's a step closer to a vision that is ever becoming so closer compared to what we were 50 years ago, when more than half the population unfortunately died of cardiovascular disease. Now, whilst there have been tremendous and remarkable steps forward, what we have seen is improvements in prevention, diagnosis, care for each and every Australian, whether that's young kids born with heart disease or older Australians who are living with chronic heart disease. These steps have been remarkable, and it's increased the standard of living, the quality of living and life expectancy. But it's a job that's far from done. today and each and every day we still have 48 Australians who die from heart disease, and some of those are kids. We still have 400 people admitted to hospital each and every day. That's 1 every 3 minutes. Now this money will go a long way to making sure new ways of preventing, diagnosing and treating heart disease, which will be a great leap forward. So hopefully, and one day we can see heart disease is a thing of the past. Now, on behalf of the Australian community, the Heart Foundation, together with our partners, the Australian Cardiovascular Alliance, would like to personally thank the federal government as the biggest funder of cardiovascular research and the Heart Foundation as the biggest non-government funder, the great initiative and investment through the cardiovascular mission and the dedicated support and investment in cardiovascular research, and hopefully through these little steps that it will eventually and in years to come bring new ways of improving, diagnosing and treating heart disease that will not only help little kids but also help each and every Australian, whether they're living with heart disease today or tomorrow, for those Australians who are at risk of heart disease. Thank you.
Happy to take your questions. I'll start with those in the room and then go to Dana and Richard and Mel, who are online.
Do the protests make a mockery of restrictions and the efforts that we've made so far?
So we believe that it's fundamentally important for people to be able to express their democratic right, to have compassion, and we respect that deeply. But a mass gathering, whether it's a protest or a football match, whether it's an artistic endeavour or an expression of views, a mass gathering at this time is not safe. It undermines and risks all of the work that Australians have done to save lives and protect lives.
Maybe a question for, yes, thank you. We can't stop people going. Obviously people are going to attend these protests. Would you be encouraging them to get tested if they have attended a protest over the weekend?
No, we're not. We are suggesting that anybody who has any respiratory symptoms at any time in any part of Australia gets tested. Any sore throat, any cold, any cough that's unusual or suggesting a viral infection, any fever, that's when you need to get tested. So we're not suggesting that if people go to an event they get tested unless they become unwell. But what we are saying is, if you are going to an event like this, please try and practice distancing if you can, but we would prefer people not to go.
We've obviously had protests in the United States for more than a week now, and we've seen large gatherings. How closely are you watching the numbers over there, given how many people are in close proximity?
We certainly are watching the numbers over there, but they are in a very different place to Australia. They have, sustained and continuing community transmission of large numbers that we don't have. So we would probably see a bigger readout than they might more quickly.
While you don't want people to attend the protests, they obviously will. If the numbers don't spike after the protests, will that change restrictions if you see mass gatherings and there's no...
No, I think this is a matter of principles and safety. Of course there could be a gathering where there is no infected person, but we just never know. And what we know is that one person, one single high viral load person can infect 30, 40, 50 other people. We've seen that in Australia. One person infecting 35 people at a wedding. So it is an incredibly infectious virus. So you just need one person in a large gathering where people are packed together and moving around, and you can have a large infection. So it's just a simple precaution. Large gatherings with closely packed people are fundamentally dangerous.
When will we know if there has been an outbreak because of these protests? How long will it take?
Generally speaking, the incubation period of this virus is about a week, and then it often takes a week or more for cases to emerge. So if we were to get an outbreak related, we would probably see a readout in about 2 weeks.
And how worried are you personally that this could cause a second wave and put us in a worse position?
Look, I'm worried about any relaxation of physical distancing beyond what we've recommended across the country at the moment. Anything that puts at risk increased community transmission. This is one type of event that I'm worried about, but there are lots of other things, people gathering in large crowds at the beach, people having large parties. A lot of things worry me. We have to continue to be cautious. So I am worried about any tendency to recommence large gatherings.
I would say this, that any mass gathering at this time is a lottery with people's lives.
Thanks. Do you think that we should be fining the protesters? Would that be more of a deterrent?
I'll leave that to the Victorian and New South Wales governments. I know that they are managing the question of public order, of endeavouring to make sure that they are able to manage in the best possible way. But all governments have expressed their deep concern, both through their medical experts, the chief health officers, the chief medical officers, unanimously today made that statement. But I know the Victorian government, the Victorian Premier, the Victorian chief health officer have, for example, expressed their extreme concern that this will put people's lives at risk.
Would you prefer it be cancelled altogether?
We do not want to see a large mass gathering. It's not whether it's a protest, it's not whether it's a beach party, a football match, an arts event. This is not the time for large numbers of people to come together. The protest can still continue online, outside people's front doors, in the same way that we respectfully and safely did the Anzac Day vigil. That's taught us how to be creative, how to be respectful, and how to be powerfully moving whilst not putting others at risk. All right, I might go to Dana first.
Thanks, Minister. I just wanted to ask you about the academic paper in The Lancet that was retracted about hydroxychloroquine. The study was found to be based on inconsistent data. There's a lot of frustration in the Australian research community about how this study sort of derailed the research being done into that area. Just wanted to ask what impact do you think that would have on trials in Australia, and are you disappointed that the paper was published in the first place?
Look, I'll make a brief statement and then pass on to Professor Murphy. When I was with Professor Doug Hilton at the Walter and Eliza Hall Institute this week, he expressed his real concern about this paper in The Lancet. He raised the fact that there were issues with the academic process and the academic merit, and he was right. And so what we see is that Australia is taking cautious, careful steps, following the highest medical standards to look at a range of different therapies and treatments, as well as developments of vaccines. And we'll continue with our programs. And what we have done all along is take the advice of the Australian medical experts, and that I think is fundamentally important. Brendan?
Thanks, Minister. So the Lancet did the right thing, as all reputable medical journals do, which is when questions are raised about the integrity of the data, they have had the paper withdrawn. So at the moment that paper has no status, and the situation with hydroxychloroquine is it is still an investigational drug. It is still a drug that is being studied in trials in Australia and in other countries, and we still await evidence about what its place may be, if any. Thank you.
Great. I'll turn to Richard Ferguson.
Thank you, Minister. This one's for you and for Professor Murphy. What is the risk of Indigenous Australians who are attending these protests to their health, considering they are in such a high-risk category? And are you concerned about the risks of people at that protest then going into metropolitan and remote Aboriginal communities and the virus possibly spreading that way?
Sure. Look, we know that Indigenous Australians, as a general principle, have higher comorbidities, lower life expectancy. That is one of our great tasks, and it would be a terrible irony if, as we pursue the national goal of increasing the health of Indigenous Australians, there is a protest which put that health at risk. There may well be many people associated with Indigenous Australia, and if they attend a mass gathering, they then risk taking that back to their elders and their elderly, people who may be more vulnerable than others. And so that's why this protest is doubly dangerous to Indigenous Australians. I'll ask Professor Murphy to make some comments.
Thanks, Minister. So one of the things that absolutely terrified us at the outset of this pandemic was the consequence of an outbreak in a remote Indigenous community, where, as the Minister said, there are higher comorbidities, and the risk to loss of life and spread of this virus in some of those remote communities would be catastrophic. We have done so well. We have done remarkably well in protecting our Indigenous communities from this virus. We've had very, very few cases in Indigenous Australians, and most of them are from return travellers and in metropolitan areas. This would be an absolute tragedy if we got that virus into one of our remote communities, and I strongly support the comments that the Minister's made.
Great. I'll now take comments from Melissa.
Yes, thank you. Can I ask both of you, firstly, Minister, we have already seen